Hi, I'm Dr. Yvonne McCartney. I'm a local GP in the area. I work at Epworth and Women's Health Clinic and Kensington Hill Leopold. Thank you so much for letting me be involved in Women's Health Week. It's a topic I'm really passionate about, and today I thought I'd walk through a women's health check, which isn't necessarily just one thing. And so to try and keep myself on track and not getting any distractions or anything like that, I've popped together a couple of slides for you guys to follow along with. So we begin with adolescence, and so the first kind of structured thing is the Gardasil vaccine. Now this is really exciting because it's the first time that we've proven that a cancer is caused by a virus, and we've come up with a solution. So the Gardasil vaccine vaccinates both women and men against the HPV virus that we know causes cervical cancer. It's normally, automatically given through high schools, but certainly something that we give in general practice as well. Not only does it protect against cervical cancer, it also protects against 2 strands of genital warts. Now, the other ones I have here aren't specific, scheduled checks, but I thought they were really good opportunities to actually just check in with your health. So I know a lot of women roll their eyes or begrudge having to just get a script for the pill, but it's a really good opportunity to check in and see, is it the best contraception for you? Is it controlling your periods or doing what you want it to do? But also how are your periods in general, as well as an opportunity to offer STI screening. And STI screening, not something that's really invasive as people may shudder to think, but can be a simple urine test. Chlamydia and gonorrhea are the most common STIs getting around in the community, and it's just first bit away, first thing in the morning, and you're done and screened. Of course, with adolescents and throughout life, it's really important to check in with mental health. None more obvious than the times that we're in now with the pandemic. So moving along to the 20s and 30s, and again, this is a way to structure it, but every time you see a GP is an opportunity to improve your health. But the main one is the cervical screening test. So that kicks off at age 25 and goes out to age 74. So about 7 in 100,000 women will be diagnosed with cervical cancer, which we've halved since 1987. Unfortunately, though, what we haven't made a difference with is the 5-year survival. So we are really good at preventing cervical cancer, but we're still no better at treating it. So it's really important you come in for your test. I know it can be daunting, but it is an opportunity to, as I said, have a full health check, and also other things that you may be concerned about, such as vaginal discharge or painful sex, periods again, pelvic pain, or also family planning, and just really trying to nail down those healthy behaviours that will set us in good stead throughout our life. I thought I would mention that yes, there is a self-collection option available. Something's better than nothing, but certainly it just limits the examination. A little bit on family planning. There's a lot of time you don't have to wait until you get pregnant to chat about this. So there's certain things that we do before falling pregnant that can really make you go in with your eyes open. So there are genetic testing for cystic fibrosis, smooth muscle atrophy, and Fragile X syndrome. We check your immunity to things such as chickenpox, rubella, measles, mumps, hepatitis B. So we can vaccinate you against those things prior to falling pregnant, and then they won't be a problem in your pregnancy. A good time for education, and it centres a lot around ovulation. When you ovulate, when's a good time to actually be trying to fall pregnant, addressing concerns about subfertility or a delayed fertility due to contraception, and also screening for conditions that may make it more difficult to fall pregnant, such as polycystic ovaries, or whether there's a family history of premature menopause. At 40, we start breast screen, and I guess this is the most well-known women's screening thing. It's really wonderful. We've really made breast cancer into a treatable disease as a result. The key is to get in early, so when the cancer itself is small, confined to the breast, and that will give you the best chance for effective treatment. It will give you the best survival rate, it will give you the most treatment options, and also the best chance of quality of life. So as I said, it starts at 40, it extends to age 74 and occurs every 2 years. There are certain risk groups that changes, and you can work out whether or not you are in a risk group by going to iPrevent down here and the Peter Mac website. That will ask you a lot of questions about yourself and your family, and basically let you know, are you a special case? Are you at increased risk? We also want you to examine yourself, so know your own boobs. Approximately like once a month, you want to examine the whole entire breast. There's no right or wrong way to do it, as long as you're covering the whole area, so from the armpit up to the collarbone. What you're looking for, well, you're feeling for lumps, thickening, you're looking for dimpling, redness, any nipple discharge or painful areas. And of course, if any of that is present, straight to your doctor to get checked out. What reduces your risk of breast cancer? Well, activity. So inactivity is the biggest risk factor for all-cause morbidity and mortality, and it's definitely true with women. So getting active, ceasing or reducing alcohol, because we know that any drink increases your risk, focusing on your nutrition to keep that healthy weight range, don't smoke, and if at all possible, breastfeeding, but that's not always the case. One thing that probably is not known about as much as it should is cardiovascular disease in women. It is what is going to get us. So unfortunately, a third of all female deaths are due to cardiovascular disease, which is 3 times higher than breast cancer. Why does it get us? Well, at least half of us don't present with the classic central crushing chest pain. And once we actually know that we have heart disease or suffered an event, we're less likely to attend cardiac rehab, take our medication regularly, or make those healthy lifestyle changes that will turn that ship around. Probably because we're too busy doing everything else, but this is something that we really need to focus on. Furthermore, any pregnancy-related conditions such as preeclampsia or gestational diabetes will follow you through after the pregnancy. So there is a heart health check. It starts from age 45, but if you're an Aboriginal or Torres Strait Islander, age 30, we check your blood pressure, cholesterol, check out your blood sugar, try and stop you smoking, definitely encourage you not to take up smoking. Again, alcohol, activity levels, weight, and looking into your family history to work out your risk level. What are the main risks for women? High cholesterol, overweight, and inactivity. All these things increase after menopause. So just a little something on menopause. Again, I mention it because it's not just hot flushes. A lot of women at around 50 feel like they're just going crazy, that they don't know why, they just want to breathe fire on the whole town. But it can be your emotions, it can be menopause that's making you feel that way. Why you've started wetting yourself, it doesn't have to be normal. I think that there's probably an acceptance in women that you're going to wear yourself, that you can't jump, all these things. It doesn't have to be that way. And also I just mentioned that itchy skin and musculoskeletal complaints, because again, they go under the radar of what could be going on in the background. Osteoporosis, bone health, that will also nosedive at menopause, unfortunately. So it's really important that we have calcium in our diet, vitamin D from the sunshine or supplements, and weight-bearing exercises to build up the muscles to support the bones. And whilst not specifically, I guess, women's orientated, it's for everybody, is Bowel Screen. So do not throw that kit out when it arrives on your 50th birthday at your door. Australia is unfortunately one of the has the highest incidences of bowel cancer in the world, with 1 in 23 Australians being diagnosed with bowel cancer. So, prevention or getting onto it early, again, gives you the best treatment options available and the less impact it's going to have on you. So again, thank you so much for letting me be a part of this. Get to your GP. If you think your GP won't cover this, book a long consult and ask the questions, or ask reception who in your practice, has a special interest in women's health. Go to a women's health clinic. There's women's health at the Epworth, there's Jean Hales, and then there's also allied health. Pelvic floor physios are wonderful in terms of women's health, and also there's psychologists available, because a lot of the time our moods, our emotions, our mental health underpin our well-being. All right, so get out there, get checked, and look after yourself. Bye.